Good morning. My name is Dr. Cary Ganz. I'm a dentist here in Garden City, New York, right across from Roosevelt Field, the new Neiman Marcus. You can always reach me at 516-741-1230. The purpose of today's call, today's Facebook Live, is to discuss what to expect from a dental examination, because they're all different. And I think that, caveat emptor, let the buyer beware. I just think people need to know what to expect when you go into a dental office, if this is your first visit or if you've been going for years. What should you expect from a dental examination? Because it's not just checking for cavities. So let me tell you what we do in our office for a new patient that walks through the front door, and for almost every patient that comes in, regardless of whether they're an old patient or a new patient. See, one of the problems in dentistry is that we tend very often not to treat our existing patients the same way we would treat someone that's fresh into our office for the first time. And that really should be the case. Everybody should be treated as if they're a new patient coming to the office for the first time. So here's what we do. Well, the first thing we do is we have a brief consultation. We go over their medical history, we go over your past dental history, and we find out what your issues are, what problems you may be having, do you have any concerns about dentistry, etc. Who are you? It's not just your teeth, but who are you? So that takes a couple of minutes, as long as it takes. And our system allows us, as much time as we need, whether it's an hour and 15 minutes, an hour and a half hour, an hour and a half. Time is not the issue. This is not an in and out in a half hour. We don't do that. So we take some time to figure out who you are and let you know who we are, so that we start to develop some kind of communication, some kind of rapport. Because there are very few professions out there that are as closely connected between the customer, the patient, and the provider. We work within that 4-inch space. It's a very private area. So we want to get to know each other, both ways, by the way. So after the brief consultation, after we've gone over your medical history to make sure there's no issues there, then what we'll do is we'll go ahead and take the necessary records that we need in order to diagnose properly. So what does that typically include? Well, before we even get there, we take your blood pressure. So why do we take your blood pressure? Because we do it as a screening. We know we're not your physician, but we want to help people if indeed we find blood pressure that's a little bit high or low or whatever. We just want to alert you so that you can go have it checked out. And we do this every time patients come in. So it's just a screening test. We don't provide medication. We don't treat it. Purely a screening test. Then what we'll do is we'll do an oral cancer examination. And we have a specific type of device. It's called a Bioscreen. And it helps us identify areas that may be pre-malignant, malignant, or just abnormal. So we'll do that as well. There are thousands and thousands of cases of oral cancer diagnosed every year that can be treated if caught early. So we're very concerned about that. So that's a really important part of our examination. Then what we'll do is we'll go ahead and take any necessary x-rays that are required. We use digital radiography, digital x-rays, computerized x-rays, so that the radiation levels are very low. There's no developing, there's no fixer and developer, and there's no waiting time. It's instantaneous, and it pops up on the computer. So we'll take whatever necessary x-rays in order to allow us to diagnose properly. My hygienist will also do what we call a periodontal exam, and she will then go ahead and check your gum tissue and probe with a very small instrument to see if there's any areas of concern regarding your gum tissue. Do you have any pocketing? Are there any mobile teeth? Do you have any bleeding points? Things of that nature. We will also go ahead and chart previous restorations, so we know where you started and where you end. So each time you come in, we can verify and check to make sure there haven't been major changes. We also use a device called a transilluminator. And what this is, it's a very special light, all non-invasive and pain-free, that allows us to see if there are any cracks or breaks in your teeth before they crack. So we want to know this so we can avoid the problem and treat the issue early rather than waiting until it becomes a problem, typically over the weekend, Sunday afternoon when you're about to go to a wedding or something and the tooth fractures. So we want to find these things first, so we do use transillumination in the office. We also use a device called a diagnodent, which is a cold laser. It's painless, pain-free, can't do you any harm, but it finds decay in areas of teeth that cannot even be felt with the instruments we use. So it finds very early decay and allows us to treat that early decay before it becomes bigger decay, more expensive, and painful. So we do a clinical examination, we do a periodontal examination, we use the diagnodent, we go ahead and use the transilluminator, we do a bioscreen cancer examination, we take a full mouth series of radiographs. I do an exam as well as the hygienist, so which both sets of eyes are evaluating. We then see what's going on. If your issues are complex, we may take a set of study casts so that we can diagnose this when you're not in the office and come up with a treatment plan. If it's something simple, we'll sit down with you and explain what the problems are, what your alternatives are, and what we believe is the proper course of treatment. We will also go over the cost, because you need to know what the cost is as well. Now, I don't think I may have left something out. Now, doing this on Facebook Live is something else, but I think I've covered pretty much what we do. Now, we don't normally do a prophylaxis, what unfortunately is called a cleaning, typically that visit, unless you request it. What we will typically do is schedule that at a separate time so that we can, give you the full benefit of the hour that you need, so that the hygienist can do the kind of care that you require. If it's something you need at that initial visit, we can usually schedule that as well. But that's a separate visit. Periodontal maintenance, as we tend to call it, is something that should have its own time, and allow the hygienist and you not only to take care of your mouth, but to go over home care and things of that nature. So that's pretty much what we do. I don't think I left anything out. I think I got it all. So once again, just to go over it, we do a cancer exam, we do a transillumination, we do a diagnodent exam, we do a periodontal exam, we do a clinical exam, means the hygienist looks at your mouth, I look at your mouth. We take whatever necessary x-rays are required. We will go ahead and take study casts if they are required, because there may be more complex issues that we need to have you in the office when you're not here. And we just pour models from those study cast impressions so that we can go ahead and do it. Then we'll sit down with you if it's something relatively simple and talk to you that day. If it's something more complicated, we'll schedule a separate consultation where we can go over it and sit with you and your significant other if necessary and discuss treatment. That's how we handle that situation. Now, we also have other diagnostic tools where, if necessary, we can go into greater depth, but it's not always done at that visit. There we have computerized bite analysis tools. We have other tools that we evaluate temporomandibular joint problems, but that's typically as a separate visit and doesn't necessarily involve every single new patient and every recall patient, every care patient in our practice. I thought I'd go over this so you have a method to compare what you're getting now with what we do. Now, what we do may not be for you. It may not even be the best. There may be people out there that do much more than we do. At least you're getting some baseline. You're getting some idea of what a dental exam should be. Dental exam is not just someone coming in, taking 4 x-rays, taking a sharp instrument called an explorer and checking your teeth and saying everything's fine and leaving. That's not a dental exam, in my opinion. It takes time, it takes effort. We allot at least an hour, if not an hour and a half, for a new patient so that we have the time, we're not rushed, and we can do all the things that we need to do to make sure we've examined you properly, we've checked everything we do. Once again, the cancer exam, by the way, is not only with this device, we do an intraoral exam as well, so that you're really getting a full examination. Hope this makes sense. I hope this gives you at least some idea of what we do. You can compare it to what you're getting now. You may request your dentist to do more. They may be doing this more than we do, which is great. And if there's something they're doing we're not, I'd love somebody to give me a call and tell me what that is. Because then if it's something I think appropriate, we'll add it to our armamentarium and use that in our office. Anyway, Dr. Cary Ganz, that's just a brief analysis of what to expect from a dental exam. Have a great day, and if you need a dentist and you're here on Long Island, give us a call, 516-741-1230. At least you know what to expect that first visit. Have a great day and keep smiling.